Enhanced recovery after surgery and swallowing difficulties with solid oral dosage forms. By Dr. Carlos Sandoval Herrera. Swallowing difficulties with solid oral dosage forms or pill dysphagia. It's more common than what we think. In adults, the incidence ranges from 10 to 40% or up to 1 in 3 adults. In children, the incidence is 50%. In older adults, the incidence is 68%. ERAS protocols have preoperative, intraoperative, and postoperative pathways. For the preoperative pathway, which is commonly a forgotten pathway, the medications can be opened from the capsule or crushed. A common mixer is applesauce, yogurt, or pudding. Gabapentin has a liquid version with 250 mg per 5 ml. The meds for the preoperative pathway are as follows. Celebrex 400 mg capsule, open capsule, and pour into 5 ml of applesauce. The most recent evidence supports only a single dose of Celebrex preoperatively. Tylenol can be crushed and dissolved in water. There is a commercial presentation Tylenol dissolve packs that come in berry flavor and have 500 mg strength. Gabapentin 600 mg capsule, open the capsule and pour the powder into a mixer. Pyridium 200 mg tablet crushed into a mixer. For gabapentin, use caution due to elevated fall risk and sedation. Do not use pyridium with renal impairment or pregnancy. The post-operative pathway while in the hospital. Toradol 15 to 30 mg intravenous Q6 hours for 4 to 6 doses. Use with caution if increased risk of bleeding and do not combine with Lovenox. Tylenol 1000 mg by mouth 3 times a day. Gabapentin 300 mg by mouth 3 times a day. Pyridium 200 mg by mouth 3 times a day. Rescue dilaudid 0.2 to 0.3 mg every 3 hours. Most patients will not request a third dose, and it is rare that patients request dilaudid at all at our institution. Use ice packs 4 times a day and an abdominal binder. Early ambulation within the first 6 hours of the surgery is critical, and remove the Foley catheter by 6 hours if there is a Foley to gravity. The post-operative pathway at home. Think of it as maximum allowed dose per day and in times administered per day instead of thinking of it by posology. Instruct the patient to take the bundle at 7 a.m., 2 p.m., and 9 p.m. The ibuprofen 600 to 800 mg 3 times a day crushed and mixed. The most current evidence favors 600 mg. The Tylenol 1000 mg 3 times a day crushed or the commercial version. The gabapentin 300 mg crushed 3 times a day or the commercially available 250 mg per 5 ml presentation. The most current evidence only supports its use for 3 days. The pyridium 200 mg 3 times a day. Do this regimen per schedule for the first 3 days to maximize the anti-inflammatory, analgesic, and neuropathic pain. This bundles inhibit prostaglandins, cyclooxygenases, peroxides, the descending serotonergic inhibitory pathways, anandamide, and activate vanilloid and CB1 cannabinoid receptors. The bowel regimen is a chewed tablet of simethicone or Gas-X with every meal and Miralax once or even twice daily. The most current evidence is in less favor to use Colace. Some surgeons are including methocarbamol in their at-home postoperative pathway. I have not been able to locate evidence for the use of this medication as an ERAS bundle component. But, researching on drug-to-drug interactions, it can be added. But, what about the narcotics? Try to avoid them. At our institution, our rate of prescription to go home with a narcotic is virtually zero. Personally, my prescription rate for narcotics to go home with is 0. We don't have emergency room visits for uncontrolled pain. You can crush Norco, Vicodin, hydromorphone, morphine, and tramadol. Mix with the applesauce, yogurt, or pudding. Some surgeons give a limited number of tablets of narcotics. An example could be 5 to 10 tablets. The non-pharmacologic interventions. Ice packs 4 times per day for the first 10 days. It can be hospital-grade ice packs, a TheraPack, or a Ziploc bag with crushed ice. Same goes for heating pads. The use of binders limits movement and provides comfort. The use of TENS can be helpful, and most recently a patient showed me a hysterectomy pillow. All this above interventions provide comfort. Thank you for your time. Comments below.